You.
Yes. Selamat pagi, good morning. Assalamualaikum warahmatullahi wabarakatuh. This is Dino Patti Djalal from Foreign Policy Community of Indonesia in Jakarta. And today we are very fortunate to have special guests and a very important topic which is to discuss the update on the fight against COVID-19, and this is going to be provided by none other than the governor himself, Governor Ridwan Kamil. And this is quite a special format that we're having. This is a format where Governor Ridwan Kamil will brief foreign ambassadors who are in Jakarta, and the discussions will be between the governor and the foreign ambassadors. We have the ambassadors from EU, from France, Singapore, Germany, Poland, India, Sweden, Argentina, and also representatives, the DCM from the United States, from the UK, Mexico, and other countries. So this is going to be a very interesting discussions. Governor Ridwan Kamil is a maverick politician and a longtime friend of mine. He became a governor only 2 years ago. And when he became governor, he was already one of the most popular mayors in Indonesia. He was named as one of the world's top 50 political leaders, not in the region, but in the world. And he has captured a public imagination, not just in West Java, but throughout the nation. Ridwan Kamil is facing now, arguably, but I think I'm not wrong in saying this, his first big, gigantic crisis of his political life. And he has been forced to switch from the normal leadership to crisis leadership. And I think the whole country is watching him. In a recent poll or several surveys, they have found that the constituents in West Java has the highest regard for the performance of Governor Ridwan Kamil relative to other provinces. Obviously, other provinces are doing well as well, but the highest score was given to Ridwan Kamil. So West Java is a huge province, more than 50 million people. I think it's like twice the size of Malaysia. So what Governor Ridwan Kamil does to fight COVID-19 is a matter of great interest to the fight of COVID-19 in Indonesia. So without much further ado, I will give the floor for Governor Ridwan Kamil to give his presentation. Governor, the floor is yours.
Thank you, Dr. Dino Patti Djalal. And also, good morning to all excellencies, ambassadors of our West Java friends. I would like to share to you the updates of how we in West Java fighting the COVID-19 per May 11. The purpose of this, I would like to share, and at the end, maybe I'm hoping I can get a feedback from all of you based on your country's experience and how in your country strategies to end the pandemic as soon as possible. First of all, I would like to share slides. This one is data that we know today. Yeah, is more than 4 million confirmed cases, and also we see highest number also happened today in many developed countries as we know it. Next. And last night in formal announcement from the central government, the Indonesia confirmed cases is more than 14,000. Good news is the number of recovered patient is more than the death case. And in terms of number of cases, Jakarta is number one because I believe the pandemic is also related to density. It's a density disease. The denser the area, the more COVID cases likely to be found. Second is East Java, less populated than West Java, but has higher number of cases than West Java. Next. Now, if we go to West Java, we have 1,437 confirmed cases last night reported to central government. And as you can see, the top 5 mostly call a city instead of regencies. Depok is number 1, circling Jakarta. Bekasi also number 1. The capital, the third, Bekasi, Bogor. So majority of case of pandemic COVID happen to be any place near Jakarta. I think more than 70% of the cases happen in Jakarta great area. Next. But if you compare to populations, because as you know it, we have around 50 million people, similar size to South Korea. Our number of cases per 1 million is basically very low, proportionally compared to other provinces. We are the bottom 2 from this chart. Jakarta is number 1 because Jakarta has more numbers of cases, and also the population is only around 9 million something. Yeah. So according to this statistic, we try to keep our percentage of cases compared to population, try to be as low as possible, using our way of doing in fighting the COVID. Next. We are also the highest numbers of testing, because to fight COVID, we have 3 strategies. Number 1, preventions. Number 2, testing. Number 3 is preparation for the what we call the healthcare facilities. So this is what we do according to also HWO protocol. In prevention, we have partial lockdown, or as PSBB. We are forbidding the homecoming rituals to come to West Java, and also all healthcare protocol for West Java. And the second strategy is test and tracing. using this massive testing, aggressive tracing, we found 5 clusters in West Java, but the last 2 weeks we didn't find any new clusters, more local infections, and also by the homecoming forbid in West Java, the reduce of imported cases happen. We are doing the massive tests in 10 laboratories. We have 10 laboratories across the West Java, and we now shifting also the tests mostly to PCR, and with the good news of we can produce our own PCR reagent for PCR tests by the biopharma company. 5 strategies in leadership that we are doing in West Java. Number 1, excellencies, is we always proactive. Yeah, we try to be always hands-on. We do not wait for the central government to give directions. For example, 2 weeks before Pak Jokowi announced the first patients, we declared the Siaga Satu, or the state of alert of COVID, 2 weeks before the first case was announced. We were also the first to test our own PCR testing. When by the time the central government still centralized all the testing in Jakarta, West Java took action to test by our own laboratory, and this is more or less the proactive approach up to today on how we handle. Kembali, second value is we try to be transparent, because we know we have to face the reality. Jangan geser-geser dulu. Full screen. We have to be transparent. So by doing this, we are the first also to open the data to public and create what we call the apps of Pikobar, Pusat Informasi dan Koordinasi COVID. Within the apps that you can download on App Store or Google Store, we open the data daily. We do data analytic for publics. So we have features for donation, for registering for volunteers. You can apply for testing also online. You can verify your safety net also by Picobar also, and many more. The third value we are doing in West Java is we always try to be scientific to our decision making, where and when to have partial lockdown or PSBB, also based on the scientific and so on and so on. Number 4 is we mobilize our industry to be focused on healthcare products and emergency today. So we try to be innovative. As you know, 60% of industry located in West Java, and with today issues, we ask all the high-tech company to start building supplies and products, PPE for West Java. So currently, because we have so many industry, all kind of personal protection equipment we produce our own in Bogor, our surgical mask. We produce our own PCR now by Bio Farma in Bandung. We produce a low-cost ventilator by PT Pindad. and also Dirgantara Indonesia shifting the military product and airplane product focused to build the ventilators. And number 5 is value. We try to be collaborative. We're asking everybody, including some of your help has been received by West Java. I would like to say thank you. Some of the company who invested in West Java also helping us. We mobilize the housewives in our organization PKK to be responsible for lunchbox movement for the poor and many more. Yeah. So this is basically our 5 values that we are doing in fighting COVID. Now, for example, so go back to the statistic of testing. Yes. Next. Nah, ini. Enggak yang sebelumnya. Okay. So as this is the data that we know, yeah. So you can see we try to follow the South Korea model in the first months of case. South Korea that we know tested around 0.6% of populations. So we now comparing our efforts a bit more to South Korea. Why? Because the population is the same. So you can compare that we have 50 million population. South Korea also has more or less 50 million population, Pak Dino, yeah. And they are testing the first months is around 0.6%, so it's around 300,000 people tested in South Korea. So, but because of our limited resources, we only tested around per today is more or less around 120,000 people, but still relatively compared to other provinces, as you see on the chart, we are the highest numbers of testing in the whole Indonesia. But our fiscal capacity is only 1% of South Korea. So you can imagine I have to save 50 million people, the same number of people in South Korea need to be saved by the president of South Korea, but I have only 1% money to creatively use to save the same 50 million people. So next. So this is also the charts on how the partial lockdown is really effective. As you see, the West Java is the in the chart colored by yellow, more or less. Yeah. Next. And this is what we call it, the reproduction COVID-19 reproduction index. Yeah. If you have index 1, it means one patient infected another person in one day, more or less. So you see the evaluation of our partial lockdown indicate that the speed of COVID-19 reproduction is slower. Before, for example, Bodebek, yeah, is 1.25, now reduced to 1.05, for example. And all the red dots, that's the previous speed of COVID reproductions, but now after PSBB is getting to index 1. So this is a good news, but it's not enough. That's my point. Yeah. Next. This is our daily check-up for our cities in West Java to check whether The partial lockdown also reduce the whole speed of this COVID reproductions. And Dino, we also starting last week started the massive operation of partial lockdown for the whole province. So I think this is the biggest operation in the country, while other are applying this partial lockdown in limited population. We decided we need to do this exercise of partial lockdown to the whole 50 million people. So for today, we are implementing this biggest operation of partial lockdown in the whole West Java. Next. This is also the data that we have. So you can see the green. The green is before the social distancing campaign, and as you see, it creates lighter color. It means less traffic. Yeah, but majority still above 30%. We try to campaign that the effectiveness of partial lockdown, if we can press the number of people in the activity only 30%. So we are trying to achieve that. So the strategy for the next following weeks is, as long as you can keep the population only 30%, any economy within the 30%, any activity within the 30%, it is okay to be low, still with the health protocol, because the most difficult time for everybody, all the leaders in the world, is try to keep the economy is going, but also pressing the COVID issues. So it's not very easy on how much the dose of economy we need to open without jeopardizing the healthcare COVID fighting. Next. This is also another statistic. The trend is slowing down, and we are happy to say that we never receive any imported case anymore. Before the homecoming, not yet forbid by the central government, we found several cases of COVID by the homecoming relatives. But now, mostly we found only the local infections. Yeah. This partial lockdown is not 100% successful. There is some anomaly in several cities. So the good news about partial lockdown, so now we have the way to diagnose which area is relatively stable and which area has anomaly. So now by doing this, we are focusing to the anomalies that happen in several cities. So at the end of the partial lockdown, then we have a scientific proof which area can be relaxed, some economy can be reopened, but some area in anomalies we are extending our partial lockdown. Yeah, very good. Next. This is also the same. The reducing of community mobility because of our stay-at-home policy is reducing greatly. Yeah. Next. This is the number of testing. It is confirmed Excellencies, that if we use the rapid test, the RDTs, the accuracy is very low. Yeah, so not recommended anymore for any places to use massive of RDT. This is what happened. We tested around 100,000 blood tests. Around 2,900 reacted to the RDT. Yeah, some say is possibly COVID positive based on RDT. So we took this 2,900 to the next step using the PCR to reconfirm. And what's the result is only 10%. So only 290 from 2,900. So it means only 10% accuracy. Yeah. So we are now use PCR as many as possible to test more. Next. We use also many forms of testing. We door-to-door testing. We have massive drive-to testing. We are now testing to the point of entry in hospital. Sorry, in terminal, in a station, a train station. This week we are focusing on the market, the wet market, Pak Dino, everywhere. Just to, and it is confirmed also the train, the KRL, the affordable train. We found 1% of the commuters found positive using PCR. So we asked the central government to shut down, but as I said, every day is a debate about how to open the economy, but also maintaining this protocol. So the problem that we found of this debate is the issue of the asymptomatic carrier. Yeah, even though you are, say, for example, Pak Dino, in this train Bogor to Jakarta or train from Bekasi to Jakarta, they already have a physical distance, 1 meter, 2 meters, but still we found 1% positive COVID. It means even though you are following the protocol, but you are asymptomatic, it means the virus is in the train, carried by asymptomatic person. So this is something that worry us, is the asymptomatic person. Yeah. Next. And this is also the sad news. But you know, we have 3 stages of emergency. Number 1, healthcare emergency, what we have now. Second is economic emergency. So I'm facing 2 problems. First problem was about only healthcare issue, COVID issue. Now I have to face the economic emergency. And the third emergency, hopefully not happening, is social and political emergency. So these slides indicating before we subsidy, but you know, only 2 million household. Yeah. Now after the COVID, we predicted only 6 million household, but it appears now 9 million household need to be subsidy. So you can imagine if you multiply by numbers of person per household, 4 persons. Before we subsidy only 9 million people, now we have to subsidy 38 million people. So from 25% of people subsidied by us now increased to 65%. So Pak Dino, this is the real issues, and this is the list of helps from many ministries and also from West Java. We have more or less around 8 doors of helps for social safety net. Next. This is one of the apps we were awarded, Pak Dino, in the World COVID Innovation Day because we can do tracing and testing and everything using the apa namanya, yang ngecek pakai kamera tuh, QR code. So this is the apps, the data. We can check the data analytics. We can have this 9 million verification features. So if you're not happy with the safety net, you go, you check the data to our apps and see whether your name on the list or not, or maybe there is some issue and so on and so on. And we can also having a telemedicine, check your health online, receive donation online also from here, register for the test and so on and so on. Okay, udah. So I think Pak Dino, that's more or less. Kembali ke slide yang data kita terbawah. So more or less the presentations, and we want to keep these charts as solid as possible. We try to keep the number case of COVID very low, relatively compared to the populations. We try to increase the capacity of testing, still the #1 in the country, but we're not happy yet. We try to push 3 times numbers of testing. We are tracing also the patients, the families, and every relative related to confirmed cases also. And one slide is very important, forget to mention, Pak Jun, yang rumah sakit turun ada. And one of the concrete good news, Pak Dino, by the end of April, we still have the high number of patients treated in West Java hospitals. Yeah, but the first week of May, you can see from the blue charts, we reduced the number of patients treated in the hospital. So it means in West Java, number of patients is mostly asymptomatic persons. No need to go to hospital. Yes, you are positive COVID, but you don't need to go to hospital. You just do your self-isolations kind of a protocol. By this data, since the 1st May, we dropped the number of patients need to be treated by 100 patients. Now, before by end of April is like 430, now reduced only 300 something. So we are not in the state of emergency in terms of healthcare facilities, not like Jakarta. So we don't need yet, Pak Dino, to transform government building into emergency hospital. Our own hospital now still okay in terms of ratio, only 50% beds used by the confirmed case. And this is a good news. Number of deaths also reduced from 7 persons a day, now reduced the number of deaths to 4 persons a day. And number of recovered ratio is double. So we are testing also some of the medicine coming from many recommended sources also. So I think to conclude again, we have some good news from West Java. We still have some challenging issue we need to tackle. Last slide, yang skenario kalau PSBB tidak PSBB. Kalau last slide I want to show you. This is a scientific reason why we are doing what we are doing. Is we believe partial lockdown is very effective. We need to improvise the way we do things in the local style, because it's totally different. I cannot use other country as a reference because it's different culture, different education level, and so on and so on. Full screen. So this is the reason why we are doing the whole province partial lockdown. You see the blue line indicating if without intervention, COVID could happen to be 1.8 million people infected. Yeah, could infected to 1.8 million. With partial lockdown only in the Bodebek close to Jakarta area, reduced to 700,000 theoretically possibly COVID. By extra partial lockdown in the capital of West Java area, Metropolitan Bandung, reduced to 100,000 possibly infected. By having the whole province partial lockdown, we can reduce maximum only to 25,000, more or less, theoretically possibly COVID. So this is the coming from our scientists, and we are exercising, observing. And next week will be the first stage of our provincial partial lockdown. We will evaluate, and hopefully, as I said, we will find which area is okay, which area need to be extended the partial lockdown. We want to keep the economy also alive and doing okay, but still maintaining the emergency capacity. Thank you for your attention. That more or less my update and my introductions. And once again, thank you for many companies from your countries that come to West Java to help us, supporting us in fighting the COVID. Thank you. Pak Dino, back to you.
Thank you very much for that very clear and comprehensive presentation. I will begin this discussion. First question will be from me, and then the next two questions, I see Vincent has asked for a hand, and then Anil, yeah. So I think Heather also raised, yeah, so those three. But the first question from me, Governor, is I observe in some countries around the world, there's always some friction between the central government and the local government on handling COVID-19. I think the most celebrated case is between Washington, D.C. And the New York governor, Cuomo, right? And in Indonesia, you know, there's been some reports about the central government and governor of Jakarta, for example. So my question would be, how do you minimize friction between the province of West Java and the central government in handling COVID-19? Right? So hold on to that question, and I will go to Vincent next, and then Anil, and then Heather for the first batch. Yeah, Vincent from EU. Yes. EU.
I wasn't aware I'd asked for the floor, but I'm more than pleased to come in now. And of course, first of all, we have a great respect for the response that the government of West Java is giving to the crisis, and also great sympathy with all the families who've lost their loved ones during the pandemic. And the EU is not much different in the sense than in Western Java, that gradually the EU has managed to come to grips with the crisis from a health point of view. Like everybody else, we were taken off guard by the crisis when it first struck. But by and large, I think the health response is now on the road, and the results can be seen. And the good thing is, and that's your story, dear Governor, shows it as well, that interventions by the government, enforcing self-discipline, social confinement, and so on, those measures do work. And your figures show it, also the figures in the member states of the EU show it. So there is no doubt that we have to continue with that policy as long as the risk remains. And that is, of course, the big uncertainty that everybody faces. How long will this last? What can we expect in terms of a second second coming of the crisis, and how long do we need to maintain the social distancing measures. And I think what you said, every day is a debate about how to go about this, and I think that is perfectly well taken. My question is about what this means for the economy of West Java. What is your sense of how companies are coping with the crisis, not only now, but also, of course, in the longer run? Companies, of course, are losing money. They're getting indebted. There is a strain, particularly, I suppose, on some of the state-owned enterprises who were already loss-making and who were already indebted before the crisis. And now, of course, there's even more stress. So my question is about that economic and socio-economic dimension, please. Thank you.
Anil?
Dino, as well as Pak Gubernur, thank you very much for this opportunity. First of all, I would like to convey our appreciation for Pak Gubernur and his team in West Java for all the strenuous efforts taken for in a very, very important, strategic, as well as very big province with its diversity and its complexity. I think we definitely appreciate the efforts that Pak Gubernur, you and your team have taken in West Java to manage the situation. At the start of your presentation, Pak Gubernur, you talked about ending the pandemic, as you said. But for many of us, I think the perception or the assessment is that it will take quite some time before this pandemic can end. And I speak from a global perspective. So it is now, we are moving to a stage where how do we live with this pandemic? How do we adjust to it and still carry on with as normal a life as possible, including on the economic front? So my question is, Pak Gubernur, in your assessment, when do you think, or do you have a projection in terms of the situation stabilizing in West Java to an extent where you can consider loosening some of the PSBB measures that you have in place based on current trends? When do you think that would be possible? And then when that stage is reached, which are some of the areas where you believe the initial loosening or adjustments can be done? Areas in terms of sectors and also in terms of regions. And my last related sub-question to that would be in terms of how will you ensure that you still manage to carry on with things like contact tracing and ensuring that there is no second or third wave coming in. I say this also because West Java is in a very strategic location. You showed us data and stats in terms of how the things in Jakarta and other neighboring regions can affect West Java. How are you going to, or what steps do you have in mind in terms of doing things like contact tracing? Will you be relying on technology to make sure that there is no second or third wave now that you have managed the first phase relatively well? Thank you very much.
Okay. Okay. Next, we have Heather from the U.S. Embassy. Yes.
Sure. Hello, good morning. Selamat pagi. Heather Variava, Chargée d'Affaires from the U.S. Embassy. It's great to be here this morning. And terima kasih banyak Pak Gubernur atas presentasi Bapak. I'm remembering our good time together at Gedung Sate back in October when we were talking about entrepreneurship and how to support the young entrepreneurs of West Java. And I hope that someday soon we can get back to doing that important work as well. But for now, I would like to congratulate you and commend you for all of the work that you have been doing. Also to extend the condolences on behalf behalf of the people of the United States for those in West Java and Indonesia who have lost their lives as a result of this terrible pandemic. And thank you for your work to prevent more loss of life. Your proactive action and your data transparency, I think, are all keys to the success of combating COVID-19. The United States has been partnering with Indonesia since February on this and committed 113 billion Indonesia rupiah, focused in particular on case detection and tracking, preventing the spread of the disease and treating those who are ill. And my question is related to some of the testing. You rightfully noted that the PCR testing is very important. And my question would be, how can we help you increase that number of the PCR testing, since we see the testing as the key to being able to open up the economy? And I'd like to offer up our experts here at the embassy. We have experts from the CDC, the Centers for Disease Control, and the U.S. Agency for International Development, who are working on our programs with Indonesia, BNPB, but see the importance of working also at the provincial level. It's a dual effort, I think, at the national and provincial levels to fight this pandemic. So I welcome your thoughts on that topic and would like to offer up our support with your team to see if there's anything more we can do. So thank you very much.
Thank you, Governor Ridwan Kamil. Please, the floor is yours.
Well, Dino, your questions about how we handle the coordinations with the central government, it is always not always an easy relationship, Dino, because sometimes the top-down approach is not really answering the issue in the local level. Yeah. So we are the one who deals directly face-to-face with our people. We are the one who directly receive complaint from the small business owners. Yeah, we are the one who need to put off the fire when it comes to social emergency and so on and so on. And every 2 weeks we have a meeting with Pak Jokowi. So usually that's the moment I post my complaints and inputs to the president. For example, Pak Dino, one of the concern in the social safety net, for example, because we have 8 doors of help, yeah, and each door responsible by different ministry. Social ministry, they have their own timing and way of sending the safety net, the social safety net. The rural ministry also, they have their own timing, their own way of sending the social safety net. The Ministry of Workers, yeah, also labor and workers also has their own timing and their own ways. It creates a confusion in the public because you receive the package from social ministry only for 2 homes out of 100 homes, for example. So the remaining home asking why we don't receive any helps, because they don't understand they will receive next week by the rural ministry. So there's so many confusion. One of examples how issues happen in the locals is not really well perceived by the central government. So I give protest input to President Jokowi during cabinet level. Second, for example, the relaxation of public transport, but this week, it's really not welcome by local leaders. But we will follow the regulation, but with much hesitations. Why? Because we are in the good mood of not receiving any imported case coming from the traveler or the homecoming visitor, Padino. By the opening of public transport, we're not sure that this good trend will last, because it means I have to test every public transportations now to check for COVID. Before, because of this is forbidden, we can control better. So I must say maybe around 30% the policy from central government is not really effective. 70% we comply. So more or less I try to simplify the issues. Yeah. But we try to keep it indoors during the FICON. I never try to express my hesitation publicly to the media. Yeah. So this is my personal way of saying that we are in one team with the central government. From Vincent, I will show you the economy statistic, but basically 2020 is will be in the bad shape. We will recover in 2021. So I will show you the slide. The slide was studied by the University of Pajajaran, Dino, on all excellency. If you see, if there was no COVID, the green line flat in 5%, we were very happy. We are 5% economy. But with COVID, if without any intervention, we will go with the blue line. We will go negative growth, Vincent, and if we recover by 2021, it will be maybe only 2% maximum. Yeah, if we don't do something concretely about economy. But we are pushing the orange line. It means we push any economic program, incentive, and so on and so on. Try to be still positive growth by 2020, maybe close to 1%, and jumping big time in 2021, and by 2022 we go back to normality in around 5%. So one of the way we do things is, number one, we after the COVID, immediate after the COVID, hopefully by July, according to our optimistic scenarios, we will start what we call human intensive projects, Vincent. So I have the budget to create all the physical project, but use in human intensive, labor intensive projects. Yeah, and since 90% of our economy is SMEs, we have already incentive from the central government, such as reducing the tax, reducing the interest from the banks, and also many incentive we try to do. And this is also to answer Pa Anil from Singapore, is we try to be creative, Pa Anil, in how to do the economy during this partial lockdown and after partial lockdown. So now, last week, Heather, I have a VCon with American Chambers of Commerce. Yeah. So my point is very simple. Even though you are in the partial lockdown status, if you want to open a business, you are okay, as long as you are testing your own staff of your factories, for example, like Amazon Web Service asking me, Governor, can I still work on our project to meet our deadline? I said, okay, no problem, but you have to test all the workers by PCR tests to prove that you are a COVID-free environment. So if you can prove your company having a COVID-free environment by having your own tests, then you're okay to go. Pa Anil, Mr. Vincent, and Heather, this is my policy here. Because if we shut down the industry, the factory, thousands of people will be lost their jobs. But if we keep opening without the healthcare protocol or assurance that they are COVID-free, so I'm also risking my effort on fighting COVID. So the policy of COVID-free certificate, more or less, that's my policy today. So please send this message to Singapore investor, European investor, American investor, that in West Java, you are okay to open your business, even though in the partial lockdown status, as long as you prove you can test your own staff from CEO to the office boy to security. This is why we need the PCR supplies big time, Pak Dino and Hatter, because the PCR is not only needed by us to test the suspected, but the PCR also will be used by many economic community and business to reopen their economy by proving to government, look, Pak Ridwan, we have tested our 10 staff, we have tested 1,000 staff, and we are COVID-free environment, so we can go back to business as normal. So this is, Pak Anil, how we try to handle that we want to keep our economy while maintaining the assurance that the COVID is in our control, more or less. We learn from the Japan also, when you relax the lockdown, suddenly there is a second wave coming also. This is what worries us also. So I think next week, when we finish the first, our partial lockdown, the provincial partial lockdown, we will have we are copying the New Zealand model, Mr. Ambassador. We will apply what we call, which area will be still in the level 4 partial lockdown, which area will be reduced to level 3 relax, which area will be reduced to level 2 status, it means almost normal, and which area will be go back to level 1, which is normal as usual. But we will use this New Zealand's model into the level of neighborhood units. So it's not in the level of cities. So for example, in Bandung, the city of Bandung, we have 150 kelurahan, yeah, or villages, for example. So we will apply this level 4, level 3, level 2, level 1, like New Zealand, to the kelurahan or neighborhood level. So within one city, you will have level 1 normality to level 4 partial lockdown exercise. That's what I will do next week when we evaluate the whole province. By doing this, then I can have a balance and have a very scientific decision which area need to be extended partial lockdown, which area by having their own small, independent and free situation again. And that is what we do to answer Pak Anil after our partial lockdown and also stabilizing the economy. As you know it, 90% our economy is SME economy, so we are trying to do as big as possible. And Pak Dino, we are also try to exercise ganjil genap approach, yeah. So for example, as long as you can keep 30% of population during partial lockdown, I give freedom to mayors to exercise which economy need to be open, because we cannot use the Jakarta model. Yeah, Jakarta is very urban, it's very metropolitan. West Java is a representation of Indonesia. We have like rural, remote areas. So economy in remote and rural area is totally different with Bandung and Jakarta. So one need to be relaxed also is different. That's why we give freedom to mayors to decide which economy need to be open or reopen according to their local specific economy. And lastly for Hatter, terima kasih Ibu. Saya merindukan kita bisa bertemu lagi di Gedung Sate. Send my regard also to Ambassador. Yes, we need the supply of PCR big time, Ibu. As I said, not only for suspected person, but also to reopen economy. We need millions of PCR to reopen economy because maybe under American investor, you have say 100,000 workers. If that 1,100 worker can be tested by PCR and prove COVID-free environment, it means the whole America investment in West Java can be open anytime soon. So this is a big message today, Pak Dino, to the whole ambassadors that West Java is open for business, but you have to prove your area is COVID-free certificate or COVID-free environment. Also, Bu Heather, we need some scientific helps on prediction, Bu. If you can mobilize American universities, for example, to help West Java, I can supply you with the data and see whether our local prediction from our local university more or less the same or different from maybe from your network of universities in America, for example. So we need that one also. For me to have second opinion when the pandemic ends, we need to be alerted, be ready for second wave and so on and so on. So I need that also from your network. Saya kira itu Pak Dino jawaban yang pertama.
Okay, so I have the next three questions. First is from Ambassador Beata of Poland, and then Ambassador Cameron from Canada, and then Ambassador Olivier from France. And why don't I take one more? I think Jonathan. Yes. Okay. So Cameron, yes. Sorry, Beata, Cameron, Olivier, and Jonathan from New Zealand, and then we move on to the next batch. I still have a number of people on my list. Ambassador Beata, please.
Terima kasih Pak Dino, terima kasih Governor Kamil. Thank you very much for organizing this video conference. It's really very needed and on time. As we are starting to think about the post-COVID time, I would like to ask Mr. Governor about your let's say future thinking about the investment climate in your province. As we met a few times and we were talking about the business to business connections, I would like to ask whether you plan any strategically any changes, any adjustments to your strategy, investment strategy in your province. Thank you.
Yes, next, Cameron from Canada.
Everyone in Pak Dino, terima kasih. Thanks for organizing this, Governor. A very helpful presentation, and we all really appreciate your frankness and honesty in managing this crisis. My question is also about sort of the medium and long-term recovery from the economic crisis that this health crisis has created. Governor, last time we met, we spoke about public-private partnerships and the importance of stable, predictable trade and investment rules. I think last fall, the World Bank released studies that the president was paying attention to, comparing Indonesia to Vietnam, Vietnam having great success in attracting investment and driving trade through investment because of stable trade rules grounded in international treaties that protected trade and investment. So in that light, I'm wondering, Governor, what would your advice be to the national government now in terms of the medium to long-term economic recovery and the role of trade and investment agreements and treaties in driving that recovery? Thank you.
Thank you. And now Ambassador Olivier from France.
Thank you very much. And thank you, Dino, for organizing this very interesting conference. And thank you, Bapak Governor, for your expose and your action, your you're an example on fighting the pandemic. I have two questions. One is linked to the questions asked by Dino at the beginning about the relationship between the central government and the local governments. Do you think that in the light of the managing of the crisis, some reforms should be made after to make a smoother running of crisis possible? And the second question, how do you assess the risk of social unrest because of the economic consequences on the poorest fringes of the population who are very much affected? Terima kasih banyak.
Okay, and then Jonathan from New Zealand, Ambassador Jonathan from New Zealand. After that, I do have the next batch, which is Peter from Germany and then Pradeep from India. But this is the batch after, so get ready for your questions. Yeah, please, Jonathan. Yes.
Yeah, selamat pagi and terima kasih banyak, Pak Governor and Pak Dino, for another very informative briefing. And I should say congratulations, Governor. It seems like you've been following WHO advice and international best practice and how you tackle this terrible disease. And I thought your data transparency was particularly welcome and very useful and interesting. So thank you. I should also mention that you appealed for more help with testing, and New Zealand will be announcing this week some additional assistance for exactly that. Others have kind of asked the questions that I wanted to ask, but there is clearly a difficult tension between health and the economy. And I just wondered what your response is to people who say, well, the treatment is worse than the disease. You know, the economic cost of lockdowns and the measures that are having to be taken are actually worse than just letting the disease run its course. I'd be interested in how you respond to that point. Thank you very much.
Governor, please, the microphone is yours.
Your Excellency, Ambassador Beata of Poland, I think our life will be totally different after COVID. We learned great deal of lifestyle change during the pandemic. I think we will see the new economy happening in West Java and Indonesia. It gives us a great motivation to accelerate the digital infrastructure to the whole West Java after COVID. I need to push the digital infrastructure in the rural area, in the remote area, to make sure the digital economy will be evenly distributed to the whole West Java, not only the urban area, because the COVID really tell us to do a new way of economy, a contactless economy. Second, also, maybe this is also the message for all of you. After the COVID, we need to diversify the location of investment, not to rely heavily in one location. What happens if one location is having the pandemic, for example, or having lockdown, and suddenly you can do any business because you rely too much on one country, for example. Yeah. So I think the diversity of investment locations would be a new economy also, in my opinion, in the post-COVID environment. And second, also, we will find the new empathy psychologically. People are more giving, people are more having empathy toward each other. Humanity beyond borders would be a new trend also. Yeah. So what's happening, for example, in Taiwan or in Philippines or in Singapore, before we don't really care socially, but now after COVID, I think we will really also concern what's happening in other countries, because COVID give us a lessons that we cannot leave this issue alone to that country. We need to work hands in hands towards the helping other country to solve the problems. So I think the new empathy after COVID will be also a new trend. I think after COVID, our food security will become a new concern. I will create also the new protocols to make sure there is no lifestyle related to, say, wild animals consumption, for example. Yeah, so we try to live more a healthy and limited but healthy life when it comes to food options, for example. So I think before COVID, that's not really a big concern, but after COVID, that's also becoming a big concern. And of course, we will create the new normal in terms of how we do things in daily basis. For example, like this, we don't have to meet physically if we can finish everything by FICON. So the contactless society will emerge during after the COVID. So I think that's my future predictions based on what we are seeing today in the COVID situations, and hopefully, and we found also the economy that still doing okay. Ambassadors are related to food. Yeah. So in West Java, agriculture is doing okay, fisheries doing okay, livestock business is doing okay, plus logistics. So I think during this crisis, go back to the basic economy also becoming the strength. For example, West Java will announce next month that we can produce rice production 3 times more than existing. Yeah, this is the new scientific. We have our first crop last week, but I haven't announced it to public. That usually with 1 hectares of paddy field land, we produce only 5 to 6 tons of rice. But with the new inventions last week, we can increase to 12 tons per hectares. Yeah. So this is a good news to food supplies, that we will focus also post-COVID to make sure the food security we can supply by our own land in West Java. And to His Excellency Ambassador Cameron of Canada, I think after COVID, we try to create a better investment environment. Before the COVID, the new law of omnibus law was being discussed, but now more or less not really moving because of the COVID. But I think the purpose of this omnibus law is really to cut the complexity of doing investment in Indonesia, to have a faster permit, to have less tax or more incentive, and also to create labor and employer relationship in much better economy. So we look forward to have this omnibus law pass, but now it become very controversial because people see this discussion of omnibus law is not the right time to discuss. So hopefully after COVID, we can pass this omnibus law in investment, and I think it will be a great news to Canadian investment, for example, and supported by proactive leadership in West Java. So I think that will be more or less. But as I mentioned to you, 2020 is a bad shape for us. That's why how I try to maintain the investment, Mr. Ambassador, is during the pandemic, please make sure for example, Canadian factory or investment in Indonesia, in West Java, you can open anytime, but you need to prove that you have tested the whole environment with PCR. So by doing so, you are okay to go. So this is how I try to keep the economy going. And to His Excellency Olivier from France, I think we learn big time. The current system is not really good. It's okay, yeah. But after COVID, I need to press the central government to give more powers to regional government to deal with any crisis. Why? Because when the crisis issue is not about policy, Excellencies, when the issue is about the number of people, like today, like pandemic, we are the one who knows what's happening in the grassroots. Yeah. So by having, for example, today so many doors of help with their own timing and their own way from the ministry who try to help, is confusing the grassroots, because one help coming this week, another help coming next week with different recipients. It confuse people about how we manage this one. And I cannot interfere because the money directly sent from the central government to the people. So for us, this creates an issue. So I think post-COVID, we need to reform how we handle crisis in Indonesia, give more power to local government, and also the data, for example, yeah. The data that we input to the central government for COVID is not the same that they announce every day, Mr. Olivier. For example, I report 30 cases today, the central government only report 5. I report 7 today, the central government report 50, combination of the previous day combined, for example. So it creates a bit confusion to our data analytic. That's why in today's pandemic, we are using our own data, not using the central government data to create scientific data analytic. This is one of the issues. Another issue, for example, today, we try to verify the numbers, the account of people who will get help. Yeah, when we try to verify 5 million data, the central government only allow us to verify 1,000 data a day. You can imagine how can I finish my job if I have to verify 5 million, but given only 1,000 data a day. So it doesn't make sense. So I criticize this, what you call it, bureaucratic kind of thing. So we would like next time data will be handled directly by local government also. And second question from you, we try to repress any social unrest. Social unrest coming from the hunger issues. Yeah, that's why we created our social movement. We call it the lunchbox movement. Yeah, so in every sub-district, kecamatan, we created a public kitchen, open kitchen. Every day we deliver hundreds of lunchbox. Of course, during Ramadan, it's not for lunch; it's for the fasting, the breakfasting. But we created evenly to 600 district, the whole West Java, to make sure if you don't get the safety net, at least you're not hungry because you got this lunchbox delivered to you by social movement. So by doing so, we make sure there is no social unrest coming from the hunger situation. We work also with the intelligence community, the BIN, yeah, because in Indonesian system we have a local intelligence agencies in the provincial level. So we discuss with them also daily basis the potentialities of unrest. But so far there is no issue, only confusions, yeah, about. I think it's happened everywhere. A confusion perceived by public on how we handle. So that's what happened, but not yet social unrest, and hopefully not. Yeah, I think, and for Jonathan, again, handling COVID from my perspective as a leader, as a decision maker, is a delicate juggling between economy and healthcare and COVID, more or less. It's always about how much the dose of economy you need to reopen or not to open is always daily questions. I'm copying your system also, but the leveling, maybe the first in country. We will announce next week how which district neighborhood will have reduced to level 4 to level 3, 2, or 1, following the New Zealand model. And hopefully we can learn from you also more after this FICON. More than I ask all of you to send us a message, a case studies in Singapore, in US, finding in New Zealand, in Canada, what's best that West Java can learn, because it's every day is a learning process for us. Every day is a daily dynamic, so we need more inputs for me to give a better decision. So I think that's more or less my response. Go back to Pak Dino or Pak Noto.
Thank you, Mr. Governor. Please allow me to take over Pak Dino's role as a moderator, because he has another scheduled press event with BNPB. So I will continue with the next round of the questions by Ambassador of Germany, His Excellency Peter Schoof. Please, Ambassador.
Yes, good morning, everybody, and thank you very much, Pak Gubernur, for this very good briefing that you gave us, and also from my side, compliments to the leadership that West Java has shown in this pandemic, and also our condolences, of course, to all the victims of the disease. Many questions of my colleagues have been asked that I would have asked too, so I limit myself to a couple of comments, maybe also coming from the experience in my country, Germany. I think we have been very lucky compared to many other countries, because we have been able at a very, very early moment of the outbreak of the pandemic to implement some rather large-scale testing. We have until today tested almost 3 million Germans out of 80 million. So we have a testing rate of 3.5%, which is very important. But like you and like everybody else, I think the new phase we are now entering into is to find the right balance between health considerations and, of course, easing. And like in Indonesia, we have a growing debate and discussion on how to manage the situation also back in Germany. I think the two basic things that I would like to mention that play a big role in the discussion on easing in Germany is that you have to be able to implement large-scale testing, and even at a larger scale than you maybe did at the early first stage of the pandemic. And the second thing is you have to really implement some tracing capacity, which is for many countries a big problem, including mine, because we are known to have serious data protection legislation, and so this is not that easy. But in order to really make sure that we don't take irresponsible risks when we ease up our societies and economies, it's very important that we are in the loop as far as the figures go. And just to share with you, because you asked for this, I mean, our easing policy, which was starting actually yesterday, Sunday, was that we would monitor the situation in the district, at the district level in Germany, and easing is done rather homogeneously. But if a district shows a ratio of 50 infections per 100,000 inhabitants, and if it exceeds this, then this would be the threshold whereby local leaders would then reimpose certain restrictions. Let me just ask you one question, which is related to this. You have rightly, of course, asked for an expansion of the testing capacity, which is very important, especially for this new phase we're entering. Now, one critical figure is of course, the time lag between the test and the result. And are you able to give us an indication what is the time lag in West Java, the average time lag between when a person takes a PCR test and he gets the result? Because this is a very important critical figure to be ahead of the wave to the extent possible. So this will be my only question. And again, thank you very much for this very informative briefing that you gave us. Thank you.
Thank you, Ambassador Peter. I'd like to proceed with Ambassador of India, Ambassador Pradeep Kumar. Please, Ambassador.
Pak Governor, thank you very much for devoting so much time and sharing details in such a frank manner. Let me take this opportunity also to convey my deep appreciation for all the assistance that Indian nationals have got in West Java province because they are currently stranded. So a thank you and a big appreciation. I fully agree with Pa Governor, as you mentioned that coronavirus would be a very defining moment. In India, people have already started to say that there will be AC rather than AD. So it will be after Corona and BC before Corona. So the life will certainly change. I have two or three small points. One, Pa Governor, just want to understand how you think the services sector will change, because services sector depends on human contact in many ways, tourism and other services. So how do you think it will change, and what will be your strategy to revive the services sector? The second point, Pa Governor, you mentioned that there will be a need for diversification of concentration of economic activity and other activity. In that context, want to understand that there will be a rationale for shifting capital from Jakarta. Will that get strengthened? And secondly, from the same point, because of the economic conditions, there will be a rationale to further delay or maybe review that decision. So which would be your viewpoint, and what will be your advice? Thank you.
Thank you, Ambassador Pradeep. Let me invite Mr. Governor, or you want to get one more question from the public, Governor? One more. Okay. So there's a question from the Jakarta Post. She's Argila from Jakarta Post. I'd like to ask whether you have acknowledged the possibility of other yet to be discovered clusters given the lack of PCR testing there. Yeah.
Can you repeat again the last question?
Have you acknowledged the possibility of other yet to be discovered clusters given the lack of PCR testing in West Java?
Yeah, okay, thank you.
Thank you.
Yeah, His Excellency Ambassador Peter from Germany, I think this is what we are trying to achieve, is to have the highest number testing as high as possible, even though today we are the highest already relatively compared to other provinces in Indonesia. But as I said, I'm not really happy yet. So we need to buy more PCR. We are produce also locally, some in Bandung. I think you tested 3 million, 3% is very, very high. And we now give a green light by the central government to use the tracing using the mobile phone technology. So Telkomsel, Indosat also give us this technology to tracing that the patient had some communication to which area, to which numbers, and so we can tested also, because within our testing, not only the patient that we are testing, but also the family. Yeah, so the fathers, the mothers, the sister, the brother, we do the testing also for the whole family, and also the close contact of the patients. And by having this massive tests using PCR, we increase in the early days. We have a capacity only 140 tests a day, very low. But now is more than 2,000 PCR testing per day, Mr. Peter, and it's more or it's around 2 days time lag. Yeah, in West Java. If you test Monday, you get the result by Wednesday, more or less. That's the speed that we have. We now massively tested around 40,000 in the next 2 weeks. We have 40,000 PCR. That's why this week we are testing also the seller in the wet market and so on and so on. And currently in West Java, with our current situation, more or less is around 40 cases a day. Yeah, sometimes 60, sometimes like yesterday reported 0, but it's always up and down. But in the median, around 40 cases a day. So if we can reach half of these, this is to answer Pak Anil also, then that's the indicator I can relax more. Because 40 cases a day, more or less, is the partial lockdown situation. So after the partial lockdown, we are looking forward to reduce at least half of what we have. Then I can have a good situation to ease the economy in many districts, also like in Germany as well. So that's more or less the situation. And His Excellency Mr. Pradeep Kumar of India, I think the theory is very simple. Once we have the vaccine, then there will be no complication in our lives. But without any vaccine, then we have to adjust big time on our lifestyle. So looking forward to any vaccine invention anytime soon, so we can go back to our life pre-COVID, not 100%, but not too much difference. But without vaccine after the COVID, I think the service sector also will be more or less affected. We will rely much on 4.0 industry revolutions, for example. Maybe we cannot do a physical check-in. We can do check-in to the hotels using also digital. It's already happening now, but maybe become more. But for Indonesia, it will be very challenging because we still majority in the labor-intensive economy, less to capital-extensive economy. So I think service sector will be affected. We will adjust, but it takes time. This is my point. And also, Ambassador, this is the historical lessons. What is the lesson? You need to move all your centralized economic activity from Jakarta. That's the lessons. Because Jakarta is like taking over 60 to 70% money circulating in Indonesia is in Jakarta. So what happened if Jakarta locked down, then the whole thing collapse. So you need to have a belief that you can diversify your head office, not in Jakarta, maybe in Bandung, in Surabaya. You need to really diversify your economic or business or cultural activities, not centralized in Jakarta. I think that's my big message to you post-COVID, is to have more decentralized kind of activities, not only in Jakarta. I think that's also my point on post-COVID situation and economy. And Pak Dylan from Jakarta Post, I think after the PCR, we don't find any new clusters. Yeah, so hopefully not. But we contain in West Java only 5 clusters: 2 in Bogor, 1 in Karawang, 1 in Sukabumi, and 1 in Bandung area. Up per today, we don't find any cluster, and hopefully not. Saya kira itu. I think that's it. And I would like to send my regard to Ibu Marina. The help from AGNM has arrived. So thank you. Send my regards to your AGNM and Swedish community also for helping West Java. Thank you. Back to Pak Dino.
Thank you, Pak Ridwan. I'm sorry I had to leave just for a little bit, but now I'm back, and I want to thank, on behalf of the ambassadors, thank Governor Ridwan Kamil for his honest and substantive presentation. We wish you all the best. I think somebody commented on this. You have a very strategic position to beat COVID-19 in Indonesia's largest province, and I know the fight is still ongoing, and it will be an uphill battle. But we do appreciate your leadership, and we are confident that West Java will be back on its feet again. I want to thank all the ambassadors who are taking part in this roundtable discussion. I think this is the first roundtable that we are having in this format, and for the public who are watching this, I hope this is useful to you. And once again, please accept our thanks and our best wishes, and may everybody stay safe and healthy from COVID-19. Let's give a big hand to Governor Ridwan Kamil.
Thank you, Pak Dino.
Thank you, Pak Ridwan. Salam buat Ibu.
Ya, sama-sama.
Baik-baik.